So transcranial magnetic stimulation is this device behind me. It's one of these magnets being pulsed at a certain frequency at a certain point on your skull. It is there to activate a certain part of your brain. The research shows that this specific thing that we're targeting when it comes to, like, say, depression, targeting this one spot on your brain leads to a decrease in your symptoms of depression. There's many different types of TMS. Most of them relate to, like, different frequencies, different lengths of treatment, but they're basically, the goal for all of them is the same, which is decrease the number of symptoms that you have for depression. This can work alongside medication. This can work independent of medication. It really just depends on, again, going back to the goals that the patient has, the preferences the patient has, and what we're trying to treat. So how is TMS different from other types of therapies or talk therapy or medications that we might recommend? So medication is, of course, like a pill that you take every day. TMS is going to be you coming in to do this therapy once a day during the week over the course of 36 days. And then, of course, talk therapy is like you come in once a week, talk to, say, like a psychiatrist or a psychologist or a counselor, and you go through the problems. They all vary in the time required to come in and do each. Medications might be that you come in once a month or once every 3 months to check on medications. Of course, TMS is going to require you to come in every day, but only for 36 days. And then talk therapy is going to require you to come in once a week for, like, a very long time, possibly. TMS is probably, along with talk therapy, the least invasive things you can do in terms of psychiatry. Other things like medications that have a lot of side effects are going to technically be more invasive than doing TMS, which is, again, the magnet gets placed on top of you, and that's sort of it. The person who is a good candidate for TMS is somebody who has either failed a medication trial for their depression, or somebody who has intolerable side effects from their medication that can't continue with their medication, or somebody who maybe just can't find a talk therapist to go and speak to. There's only one absolute contraindication that somebody is not for TMS, which is if you have ferromagnetic implants or maybe even like a medical implant too close to your head. Otherwise, on a case-by-case basis, we can discuss, like, different risks and benefits for TMS. TMS can absolutely be either used alone or in combination with other treatments, up to and including both medications and talk therapy. For people who may have a depression that's truly resistant to other treatment forms, it may be that all different modalities are required to treat their depression. And so we should not just treat anything alone, especially if it's in that treatment resistant category. So patients should expect their first session to be a little bit longer than all subsequent sessions. That session is going to be where the clinic is mapping out where to provide TMS treatment. They're going to be doing it on the outside of their head. So there's a lot involved measurements, and that one is going to take significantly longer than any subsequent appointment. As to all the other appointments, they're pretty short. You're going to come in, you're going to make sure the measurements are at the same place as last time. The tech is going to move the magnet into place, make sure that it's in the exact place that it's supposed to be at, and then your session will begin. For most people, it's not going to be that unpleasant. Some people describe it as like a tapping feeling on the top of their skull, and some people will get a headache. But for the most part, hopefully, the goal is to make your TMS session pretty uneventful. Patients do not need any anesthesia or sedation. They can also drive up to their appointment and drive home right after the treatment, so they don't need somebody else to come and be their escort during treatments. I would say the goal for noticing changes to your mood after starting TMS should be within about a couple weeks. That should be about the time when we notice some changes. Of course, coming in, we'll want to visit with you around that time just to make sure that the treatment is efficacious for you. If somebody is considering TMS for depression, the first step you should take is to talk to your doctor about it, whoever your doctor is, and see if it's the treatment that is best for you. I think bringing it up and letting them know that you're interested in it and talking about it in an informed consent way is the best way to go about it. For anybody that is interested in TMS treatment for their depression, please call today over at Holistiq and ask for Dr. O'Brien.